Good Saturday morning, everyone. Today on Perspectives, as we continue to cope with the hazards and deaths from COVID-19 here in the United States and our region, this morning we ask our local health officials, where do we stand in fighting the virus? Well, the answers that they provide help our leaders make some crucial decisions, especially now since our children are returning to the classrooms for a new school year. Several school systems have already opened their doors, and unfortunately, some are already having to make adjustments as reports of positive COVID test results are coming in. Now, this was a scene at schools across Baldwin County this past week as students arrived to school with masks on. It's a school year like no other as students, parents, and teachers deal with the COVID-19 pandemic. The Baldwin County system has nearly 33,000 students, but because of the pandemic, more than 8,000 students have signed up for virtual learning. That's roughly 1 in 4 students. It was a similar scene at Catholic schools on both sides of the bay. The Archdiocese also giving students the choice of doing the traditional school or virtual learning. They say that each school has been working all summer to make the return to the classroom as safe as possible. Each back-to-school plan has requirements that all Catholic schools will follow. Teachers have also been busy redesigning their classroom layouts to accommodate social distancing guidelines and adjusting lesson plans for distance learning. Students at Mobile Christian also returned to the classroom, and like many school officials on the Gulf Coast, Mobile Christian leaders are making special efforts to make sure that the children, faculty, and workers are kept safe.
We're doing temperature checks of all students. Elementary students, we're actually doing temperature checks before they get out of the car, but then before any student enters the building, we're doing that.
The threat of COVID-19 has forced several school systems to change their start date. Satsuma is one of those school systems. The start date for kindergarten students in the Satsuma City School System has been pushed back after 2 kindergarten teachers tested positive for COVID-19. Kindergarten will now begin on August the 27th. School officials say the 1st through 12th grade students, however, are still scheduled to begin on Monday, August 17th. There's already been a positive case of COVID-19 in the Saraland school system. Students returned last week, you may remember. The positive case of COVID-19 was reported on the 2nd day of class. 5 students were sent home to quarantine. Rigorous cleaning continues to take place, and Saraland school officials said that students, parents, and teachers should not feel unsafe as long as they continue to wear a mask and practice social distancing. Meantime, Mobile County Public School students will start their school year on September the 1st, and they will all be doing remote learning for the first quarter of the school year. School leaders say that they will reassess the situation after the quarter ends to decide the best way to continue the school year. Now, while many are concerned about children getting COVID-19 at school, many experts say that the big risk is really to family members and others that the children may bring that virus home to, like their parents, grandparents, and other at-risk people. Of course, teachers are at risk as well, and that risk hits very close to home for the Mobile County Public School System. Misty McKee, a Mobile County school teacher, died of complications from COVID-19 just this week. McKee passed away after spending nearly a month in ICU at a local hospital. A post on Facebook says, quote, "We thank everyone for all of the prayers and kind words spoken to Misty's family over the past several weeks. Please continue to pray. She will be dearly missed." The Mobile County Public School System also gave us this statement: "We are saddened by the loss of Misty McKee, who was well loved by her students and co-workers. Our hearts go out to her family and to all of the teachers and other employees at Dodge Elementary during this very difficult time." Well, for the more than 100,000 people in Alabama who have been diagnosed with COVID-19, the threat is real. And to the families and friends of the more than 1,800 people who have died, it is devastating. Joining us this morning is Dr. Bert Eishold, Health Officer for the Mobile County Health Department. And also providing insight today is Dr. Rendy Murphy, an epidemiologist and director of the Disease Surveillance Division of the Mobile County Health Department. COVID-19, where are we now? Continues on Perspectives in just a moment. We're talking this morning with Dr. Bert Ashfield, who is the health officer for the Mobile County Health Department. Dr. Ashfield, thanks again for joining us here to give us an update. As we look at where we are from international standpoint as well as nationally, we've got a surge in infections going on. Now, some health experts, such as yourself, are calling this extraordinarily widespread. The U.S. has 23% of the deaths worldwide right now, and 1 in 13 Americans being tested positive, compared to other countries where it's a much different percentage. Tell us, where are we here in Mobile County and this part of Alabama? Because Mobile County is still in second in the state with cases. What's your assessment of where we are?
Well, we have increased community transmission of COVID-19 right now, and it's actually improved as far as control since we've implemented wearing facial coverage, the mask. And I want to thank everybody for working real hard and taking this seriously. The rate previously was 22% of our COVID tests were positive back in April. Before we started masking, we were at 21.5% of our COVID tests were positive. Today, we're down to about 16-17% of our COVID tests are positive. So that's about a 20% improvement to 25% improvement in the number of people who are actually community transmission and percent of the test being positive. The goal is down to about 3 to 5% would be considered good community transmission control, but we're not there yet. And so we just need to continue working as a group. Again, personal responsibility and then respecting the rights of others.
When we hear the numbers that you report and the number of cases now being over 9,000 in Mobile County, should we not be concerned about hearing that number and the amount of cases and focus more so on the percentage per testing?
Well, I think they're all important numbers. So anytime we look at data, there are lots of components to the data, and then how we look at it. Personally, I look at that particular component of community transmission and percentage of tests. So if we do more tests and we have few of them are turning up positive, then we have less transmission of the disease in our community. The real number that's important for everybody to remember is the mortality, the number of people dying that is not significantly going up on a linear relationship to the number of actual cases that we're diagnosing. So that's good news, and that's good medical intervention, new therapies. We're learning a lot about COVID-19, and all the listeners and viewers need to remember this is a brand new illness. We have not done this before. We're learning a lot from the medical science. We're learning how to better treat the patients, and there's still a lot to learn. We're getting ready to go back to school, and our younger population has been very isolated from the community. Or we will have increased transmission when the schools go back in session? The answer is going to be yes. How many and what are going to be the outcomes? But young people do relatively well regarding to being COVID infected. So they don't have bad health outcomes. They have a more milder illness. Our hospitals are working very, very hard, and they have a significant increase in COVID patients. So that's a real concern in the community, is the hospitals being able to take care of the patient needs.
So that's what we need to look at. So I was going to say, so that's what we need to focus on, an idea of hospitalizations as well as the percentage of death rate, which of course you're seeing improvement there, but on the hospitalization side, we should keep that in mind as we are out here doing what we should be doing as far as our lifestyle decisions.
That's correct. And anytime we consume a hospital bed with COVID-19, it's a resource that may not be available for somebody who has a heart attack or traumatic injury, an automobile accident. So that is an important community asset that we need to protect. So if we can limit the transmission of COVID-19, we can maintain our ability to provide hospital services for those people who have acute appendicitis, those who may have a gallbladder, those who may find themselves falling off a ladder. There are just lots of individuals who need to have health care, and then elective surgery is still going on, so
Right.
people who need to have knees replaced, that's occurring at this time.
Dr. Ashfield, when you talked about the schools about to start back in our county and looking at that as far as the children, what about the teachers and the staff people who are in the schools? How do you feel about their situation as it relates to the children who may be asymptomatic?
Well, as we have more interactions, we're going to have more opportunity for transmission of disease. So I would say that for the teachers, for the custodial workers, for the bus drivers, for the grandparents, who are many times the primary care provider for these young people, they're going to be exposed to COVID-19. 20 to 40% seem to have asymptomatic transmission. That's why we didn't wear masks earlier on. We didn't realize that fact. So I think there's still going to be transmission. The good news is the kids do well if they get infected. So there are a few cases that have some very serious illness, but overall the younger individuals who are infected with COVID-19 have good outcomes.
Are you concerned at all with that Labor Day holiday coming up, that we'll have another spike take place because of how some folks still aren't making the proper decisions for us? Or you think that you have been able to get that message out now to everyone to know they need to be a part of masking up and, of course, the social distancing?
Well, I think it's a challenge. I have to say, I have a great, some people very, very serious, but I think there's some challenges that we have to be very realistic if they're non-conformist, and they negatively impact the health of our community. So I'm optimistic people will do what they're supposed to do, but realistic that there are many distractions, especially in the younger age groups.
Dr. Bert Eichhold, our Director and Health Officer of Mobile County Health Department, we thank you very much for your time this morning.
Thank you, Eric, and thank you for helping get the word out, and everybody stay safe.
All right, thanks again. And once again, Mobile County Health Department's Health Officer, Dr. Bert Eichhold. Now, when Perspectives continues this morning, Dr. Rendy Murphy, she joins our conversation. We'll be right back. Joining us now, Dr. Rendy Murphy, who is the Director of the Disease Surveillance Division there in Department at Mobile County Health Department. Thanks for joining us this morning as we look and talk about some of the numbers and where we are today. The worst week since the beginning of the pandemic just happened. 2 million new cases on the rise now in 25 states. And of course, Mobile County, we are still in a second place position to Jefferson County, thank goodness, but numbers that I'm sure, are you surprised at how high they still are and how many we're still getting in cases every day?
Yeah, we are in a state where we have more community transmission of COVID-19 going on right now in Mobile County than we have had since we began seeing cases of COVID-19 way back on March 19th was our first case. So for the first couple of months, we really didn't know if it was low or high because we were just starting, but I was really hoping that we would just have, in the 50s, 60s, 70s numbers of cases like we were seeing back in, late April, May. But I think, due to some relaxation of some of the restrictions or the recommendations for keeping businesses, limiting businesses, that sort of thing. We saw an explosion of cases after holidays. And again, we are seeing now an extremely large number of cases, and it's really concerning. So we're just asking people to please continue to follow those public health recommendations of maintaining a 6 feet distance and wearing your mask and staying at home if you're sick.
You know, as we look at this lifestyle choice that we're asking people to make, do you think that you can see the results of, say, something similar to what happened in New York? Their numbers were just, you know, you were praying every day that they would find a way to reduce those numbers, both in the infections and, of course, the deaths. Just unbelievable, the amount of people that lost their lives in that New York and New Jersey and that corridor. How do we get our numbers down? Because at one time, you know, we were number one, and then Montgomery and Jefferson shot past us, but now here we are. Jefferson still off the charts somewhat, you would say, and then Mobile right behind. How do we get a control over that and get people to do what they need to do for everyone's concern?
Yeah, so I think continue to listen to the public health authorities. You know, we're concerned that in July, we had 3 times the number of COVID-19 cases than was reported in June. So we have had a huge increase in the number of cases. So we know that there is a balance between public health recommendations. I mean, from a health perspective, it would be great if we could have everyone working from home and everyone staying at home to try to slow the spread. But we really have to balance the public health, the health benefits of those very, austere and restrictive public health measures with, economic reasons for, loosening restrictions, with societal reasons for people needing to move around more, for cultural reasons. So we just want to make sure everyone is adhering to the public health measures that we do have in place. So follow the safer at home order, wear masks when you're out, and you cannot maintain a 6 foot distance. Maintain that 6 foot distance to the greatest extent possible. Cover your cough, wash your hands, stay at home if you're sick. And what we really need right now for everyone to hear is if you have tested positive for COVID, whether you were symptomatic or not, you need to stay home for at least 10 days. The volume of cases reported to us every day makes it incredibly difficult for public health to contact these people on the phone and tell them they need to stay home. So we need everyone to do their part, all of the healthcare providers, everyone who's getting tested. If you test positive, stay home for 10 days and don't discontinue isolation until that 10 days has passed and you are at least symptom-free for 1 day.
Where are we now with our nursing home facilities? I know we had some numbers come in recently from one of the local places at the end of last week. Overall, though, we appear to be doing better in the nursing homes.
We did. We had a really difficult time back in March and April, and we worked really closely with all of the nursing homes and long-term care facilities to try to overcome that and slow the spread. And we've had lots of facilities that have come on the other side of their outbreaks. And then, when we had the really lower levels of community transmission in May, we really saw a great thing going on with our nursing homes in that testing was more widely available and they were able to test their staff and their residents if they had any that were symptomatic and very quickly isolate and cohort, people who tested positive, that sort of thing, to slow the outbreak. We got lots of resources, help from the National Guard, help from Centers for Disease Control to come in and assist our long-term care facilities. In the past 4 or 5 weeks, we have seen probably 8 or 10 nursing homes who have positive staff members or residents. This isn't a surprise because, again, there have been new recommendations that long-term care facilities, particularly nursing homes, do surveillance testing of all of their staff members. So we know there's asymptomatic infection. So when they test all of their staff and they come up with a few PCR positives among staff members that were not symptomatic, it's not a surprise, but it does sort of put them in that COVID outbreak column, and we start working really aggressively with them to try to mitigate and control the spread of COVID in their facility.
Okay. Dr. Murphy, of course, school's about to start in several of our local school systems. What's your feeling right now as it relates to the kids going back into those school buildings?
Yeah, these are really difficult decisions to make, and there are so many factors involved. I don't envy the superintendents and administrators that are having to make these decisions. The Mobile County Health Department Prevention and Wellness Division has been working closely with all of the schools, both daycares, K through 12, and also colleges and universities, to try to provide consultation to anyone who is finding it a challenge to interpret the plethora of guidance documents that are out there from athletic associations, from Centers for Disease Control, from school boards, State Superintendent Dr. Bob Mackey. So we've been helping them try to sort through that, answer their questions, help them make the best decisions that they can as they make decisions to reopen. Now, those schools that are choosing to reopen, we fully expect that they will see small clusters or small outbreaks of COVID in their schools, and we're trying to help them ready for when that happens, to make decisions ahead of time about how they would maybe close classrooms or parts of the school rather than the entire school, and to understand that this will be an ebb and flow, that they will open under the presumption of COVID-free. And then, like we have seen in businesses and congregate settings all over the county this summer, they'll have a few positives, and they may have to, go back to distance learning or close the school for a day or two while they try to adjust their staffing models to adapt. And then, after a few weeks, they may go back to being, able to have all their classrooms open and all their children at school. So this is going to be, we think, very cyclic as we move through the next couple of months.
Dr. Rendy Murphy, never enough time, but we thank you so much for your insight. And of course, we will stay in touch with you to look and see where we are after we make it through the school startup as well as the Labor Day holiday. We thank you so much again.
Thank you.
And again, Dr. Rendy Murphy of the Mobile County Health Department. Perspectives will return in just a moment. Next Saturday on Perspectives, we're talking about the fate of local restaurants. Now, locally and around the country, restaurants closed down at the beginning of the pandemic to help stop the spread. Now, what was supposed, though, to be temporary turned into a grim ending for many. Those that have reopened still face challenges, of course, of limited inside dining capacity and drive-through and curbside service only. We will talk with an industry restaurant association official and some restaurant owners to find out how things are now and what they believe things will look like for their industry when COVID-19 is finally under control. And for more information on COVID-19, you can contact the Mobile County Health Department at www.mchd.org. We also have a link on our website at fox10tv.com. Again, we thank our doctors for sharing with us today. Well, join us here next Saturday morning at 9 for Perspectives as we discuss those important issues. I'm Eric Reynolds. Have a great week.